Good afternoon and welcome to the Plymouth COVID-19 update. It is Thursday, March 26, 2020. I'm Steve Trifletti, Plymouth Town Moderator, and I am joined once again by Kenneth Tavares, Chair of the Plymouth Board of Selectmen, Matthew Muratori, he is the Plymouth State Representative. We're also joined today once again by Dr. Gary Maestas, the Superintendent of Plymouth Public Schools, Karen Keene, who is the Plymouth Director of Public Health, and also Robert Eisenstein, who is a senior living consultant. You can send us your questions at plymouthinfo@pac-tv.org. That's plymouthinfo@pac-tv.org. After we hear from each of our participants, we'll go to a question and answer period. And we're going to begin today, as we always do, with the town update from Ken Tavares, Chair of the Plymouth Board of Selectmen. Welcome, Ken.
Thank you, Steve. Good afternoon once again. A couple of reminders from the town, and that will start out with the transfer station. Those that go to the station, it'll be open tomorrow, Saturday and Sunday from 8 to 4. Also, we want to remind those that are candidates for office that your nomination papers absolutely must be in by tomorrow, and it's your responsibility to get them to the town clerk. Larry has his number on our website and is very easy to contact if you have any questions. Also, the town manager would like to remind everyone that questions that are coming in with the email to the town hall are being answered on a daily basis. We've had a number of good questions, and they are being answered in quick time. Also, I guess the last thing, which is my usual cry out to everyone in the community, is you're doing well. We're keeping our distance the way we should be, and we can beat this if we keep continuing to do what we put into practice. Washing hands, distance is so important. I know our health director is going to give you some significant figures, but we have 10 confirmed cases in Plymouth. No, I don't want to say that's good, because 0 is good, is excellent. But you are actually working and helping one another. Thank you so much for what you're doing.
Thank you, Ken Tavares. Ken is our Chair of the Plymouth Board of Selectmen. At this time, we're going to go to the school update. And today, once again, we have Dr. Gary Maestas, who is the Superintendent of Plymouth Public Schools. Welcome, Gary.
Thank you, Steve. Thanks for having me, and I'm glad to be back with the group talking about updates regarding the school system. I think everyone was aware of the commissioner's update yesterday. The governor also was online doing a press conference, giving information, providing information to schools in Massachusetts. The closure date has been extended to May the 4th, and we are preparing a new phase of information and guidance and resources to our parents and families and students as we navigate the closure in the school system. The central office is not open, but we are open for business through email and through phone calls. So anyone that needs to reach out to us, they can reach us, via email and also through the phone system. They can go to our website, and on the bottom of the front page, there's a directory, and you can actually find email addresses, and that would be very helpful if anyone has any questions. Parents have been emailing me and emailing our teachers, even emailing our administrators for information. I am looking forward to guidance from the commissioner later today as to what the state is recommending that we do from this period of time, actually from April 6th all the way to May 4th. So there will be some nuggets of information there that we'll glean, and we'll be working with our administrators to actually have some good content out there for our families, students during this period of time. But I'm very encouraged with our staff and our support staff. I had 2 conference calls yesterday. I had one call with 805 teachers, all of them on at the same time, and it worked incredibly well. They're very appreciative of giving information. I did another one with 305 support staff right after that, about an hour each. And I was able to give them all the information I possibly could, and we'll continue to do that once a week. Just finding new ways to operate under this new normal.
Thank you. That was Gary Maestas. He is superintendent of schools, and we'll continue and come back with him once we hear from our other participants. At this time, we once again welcome Karen Keene. She is the Director of Public Health for the town of Plymouth. Welcome, Karen.
Thanks, Steve. Thanks, everybody. As Ken mentioned, we do post our numbers every day on the website as far as cases for COVID-19, and I think we'll do a little bit of an explanation right now if possible. The first number lists the number of cases that have tested positive for COVID-19. Currently for the town of Plymouth, that number is 10. The second number, though, represents people who are still in self-isolation because they have tested positive for COVID-19, which means that if you look at those two numbers, we have had 4 people who have recovered from the virus and have now continuing to live their lives, like we said, this brand new normal. The second set of figures is a little different. If someone tests positive for COVID-19, we are given notification from the state that this person in our town has tested positive for COVID-19. We reach out to this person and we get what's called a list of close contacts. That means these are people that you have, if you're tested positive for COVID-19, people that you have been in contact with for more than 15 minutes at a time, closer than 6 feet. We need to take that list. We share that list with the state of Massachusetts, and that list of people is monitored for 14 days. So they need to be in self-quarantine for 14 days and monitored by my department. Once the 14-day quarantine is done, then they can also go on and continue their lives in the new normal. That's the fourth number that you'll see. So you'll see the third number will tell us how many people of close contacts are being monitored by the town. And then you'll see the fourth number, which means how many people are still being monitored by the town. I mean, these people have also reached their 14-day quarantine and have gone on. One other change that has occurred is in the past, if you were tested positive for COVID-19, you had to stay in self-isolation for 14 days. Before you were allowed to leave self-isolation, you would have to be tested twice. Both of those tests would have to come back negative, and they would have to be taken with at least a 24-hour period between them. The Center for Disease Control has changed those parameters. We now have a new what's called release strategy. If it has been at least 7 days since the onset of your symptoms and you have tested positive for COVID-19, and it's been at least 7 days since the onset of those symptoms, and for the past 72 hours, you have not had a fever, congestion, or any other serious side effects that occur with COVID-19, then you can be released from your self-isolation. So I hope that kind of clears up what some of those numbers might mean. But the good news, I think, is that we've had 10 cases, but now we only still have 6 still in isolation, which means people are recovering. And I think that's good news.
Thank you. That's Karen Keene. She is the Plymouth Director of Public Health. We'll be coming back to her for your questions. And we're next going to meet with Robert Eisenstein. He is a senior living consultant here in Plymouth. Welcome, Bob.
Hi, how are you? Thanks
Good.
for having me, Steve.
Sure.
Just to give a little bit of an update to the public, as you could all imagine, senior living communities, assisted living, and nursing homes, because of the at-risk population of the elderly, have taken tremendous precautions to protect that population. Their biggest challenge, as people can imagine, is not having the public coming into the building. So for the governor's order, and also we're under CMS guidelines, we're basically doing what we're doing here today. We've been on remote conference calls with all of our clients practically daily and trying to help them in any way we can. But the first rule is to have people understand and accept the no visitation rule. All non-essential employees basically have been banned from visiting the facilities for obvious reasons. The staff in all of the facilities are also being asked to provide whether they are symptom-free daily in order to come back and work on the shift, and temperatures are taken as well. So there's a lot of protections going on in most of the facilities. So far, I don't have any specific statistics as far as infection rates, but most of the facilities are used to handling internal infections. So immediately we do things like close down the dining room, we close down all group activities. It basically is isolating the patients and residents in their rooms, and the staff are also using PPE as much as they can to protect themselves as well. But I do have to say there's some very innovative ideas that we're hearing going on. For example, entertainers in general are banned because we can't have large group activities, but they're going into the hallways and playing piano on their keyboard into the actual hallway in like in an assisted living where the residents can open their doors and hear some of the music. So there's really, as we say, in some cases there's a silver lining to all of the crises going on. But I have to also give a shout out to all of the direct care workers and staff that are manning all of our facilities in town, all of our nursing homes, assisted living. We have a lot of friends and colleagues, nurses' aides, therapists, nursing staff. They're the ones that really deserve a shout out from all of us. And then lastly, I would just say, in addition to just understanding the reason for no visitation, it's very difficult for family members. There was one beautiful scene of I think it was a Sacred Heart student that went up to a nursing home window and was, talking to one of their grandparents through the window. So obviously, any way we can be creative, a lot of remote activity going on, a lot of this going on, a lot of Zoom. People are all the elders now they're pretty tech savvy at this point. And I would just point out, if anybody does require, anybody in the community or any facilities that require assistance in drafting any policies and procedures to deal with this situation, we are able to do that. And we've been doing a lot of remote work on conference calls and helping out in any way we can.
Thank you. That is Robert Eisenstein. He is a Plymouth senior living consultant. As he said, all of today's participants, as every day, are Zooming in to this update. None of them are here with me live in the studio. They're all Zooming in, and you can Zoom in your questions by emailing PlymouthInfo@pac-tv.org. And at this time, we're going to go with our daily state update with State Representative Matthew Muratori. Matt, welcome.
Good afternoon, everybody. So let's start with some numbers. So as of yesterday, 19,794 tests have been conducted in the Commonwealth. There are 1,838 cases, and unfortunately, there were 15 deaths. So we're under 10% with the amount of cases that are actually positive at this point. Just a reminder, too, that if you have mild symptoms, call your healthcare provider, get them on the phone, ask them for advice of what they are going to be, what they would advise you to do. They can do it remotely, just as we're doing now, or FaceTime or whatever. So just continue to do that. And of course, if any family member with symptoms is practice social distancing as well. And we will we'll definitely get through this. Some other numbers, just quickly. There has been, as of this morning, through March 15th through March 21st, 147,000 people have applied for unemployment in the Commonwealth. We do expect that number will be rising over the next week or two. We also have had over 100,000 people participate in the virtual town hall style unemployment programs that are actually going on virtually. There's another one tomorrow as well if people want to participate in that. As was mentioned earlier, the governor has, before I get into that, I just want to reiterate, because I've been asked some questions about this. The structure of the way the government is working right now, obviously the governor has declared a state of emergency, and quickly after that, on March 14th, put together a command center, which is now being led by the Secretary of Mary Lou Sutters of Health and Human Services. And her role, secretarial role, has been, her day-to-day duties have been given to another person to handle. So her concentration is strictly on this. And just as a reminder, this is a health crisis. Some people have asked, why isn't MEMA in control? MEMA is not experts in health, but the secretary is. That's why she's the head of the command center. But MEMA is a big part of what's actually happening in the Commonwealth, along with all the secretariats. So there is an organized way in the Commonwealth to actually get a hold of the command center, particularly if you're a company out there or people that have, access to the personal protection equipment that Bob talked about. It'll be a great way to get a hold of them to get distributed to where they're needed. Now, with regard to the order from the governor, as Dr. Maestas said, the schools will be closed till May 4th, and Commissioner Riley will be coming up with some guidelines for the schools in the Commonwealth for remote learning going forward. In addition, though, the non-emergency childcare centers are also closed as well through the 4th of May, and there are still close to 500 early childhood centers, child daycare centers that are open on a non-emergency basis. Here in the town of Plymouth, we just spoke yesterday that the Ponds of Plymouth and the YMCA in South Plymouth are open for drop-in emergency care for those that need it. And I just got announced that the Boys and Girls Club will be opening as an essential place for drop-in daycare as well. So if you're in North Plymouth area, feel free to check out the Boys and Girls Club. There are other, and just one thing of note on the closing of the schools. Obviously, we're doing this, as Chairman Navarro said, to continue listening to the folks on the front lines to keep us social distancing, keep us away. The other part of the thinking was going till May 4th had to do with most of the schools in the Commonwealth closed the third week of April. And it just made sense to close before that and after that. And hopefully by May 4th, we can start seeing a downward turn of that curve of the number of tested cases. Mm-hmm. So that I just wanted to give some little bit of background behind that. In addition, this order yesterday from the governor is taking steps to preserve the health and safety of low-income renters and homeowners. So there'll be more guidance that will come out on that, looking at preventing homelessness, of course, due to reduced incomes that people actually have. With regards to the pharmacy and grocery stores, it's clear that from the order, the governor is asking those places to allow for 1 hour for anyone over 60. So they need to start advertising the hour of the day that anyone over 60 can enter the store without anyone else. Obviously, offering sanitation options, abiding by the social distancing. Obviously, no self-service food stations at this point. And if there are any workers, obviously, they stay home as well. I've also been asked that banks are still operating. Banks are not closed. Most banks, I believe at this point, will have drive-through. You want to check with your bank, but be sure to check it out. But most have drive-through service. If you need other services beyond that, you can call your local branch, and they can do a lot of things remotely at this point, or they can guide you on what you need to do. So by all means, please reach out to the banks if the banks are not closing. With regard to I'm going to touch a little bit upon the federal response that took place early this morning. As you're probably aware, the Senate has passed a bill. It's now heading to the House, the federal House today. Congress will be working on that before it goes to the president for signature. But what was unanimously voted by the Senate, and which nowadays is it's incredible that they got a unanimous vote on this. So that tells you the enormity of what's happening in this country. The small to medium businesses that are less than 500 employees will be able to get government-backed forgivable loans to cover workers' wages, as well as some other expenses they may have. The larger companies, greater than 10,000 workers, will get some tax credits up to 50% for their workforce. In addition to individuals, one-time payments will be made If you're an individual making up to $75,000 or a couple making $150,000, there'll be $1,200 per adult and $500 per child that will be made. And then it goes up to $198,000 a couple. It's a little bit smaller for that. Those payments, again, once this is passed by the House and signed by the President, all expectations are that that will happen by the weekend, within 3 to 4 weeks. If you do direct deposit through your taxes in 2018, there will be a direct deposit into your account. If you don't, then it will be a check that will be sent out. The checks will take a little bit longer to get, but you will be able to get that income. I do know for businesses out there that the Chamber of Commerce and Stephen, with Amy Naples and Stephen Cole, the Executive Director of the Plymouth Economic Foundation, are working together and working on a program for businesses in the community to discuss this in further detail. And I think on our show, in a future show too, we'll try to get an accountant on to kind of help people through this too and get some more guidance once we actually get it signed by the President. And that's what I have for an update today, Steve.
Thank you, Matthew Muratori. He is the Plymouth State Representative. And for those of you that are watching the live broadcast during the noon hour on March 26, 2020, you can send your questions to PlymouthInfo@pac-tv.org. And as our panel get ready for the question and answer portion of this presentation, just like to give you a little information as to tomorrow's lineup. We have another exciting show. Ken Tavares, Chair of the Board of Selectmen, will be joined by Town Manager Melissa Arrighi. Once again, we're always joined by Matt Muratori, our state representative. We have a medical component tomorrow that includes Nancy Gantz from the Board of Health. Also, in addition to that, we have Danielle Fusco. She is a regional clinical specialist with Plymouth Rehab and Healthcare. Also, I'm pleased to let you know that my brother, Dr. Philip Trifletti, who is a primary care physician and attending physician with Beth Israel Deaconess, will also be joining us to answer your questions. For veterans, we have Roxanne Whitbeck, who is the veterans agent for the town of Plymouth. And for the economic update, we have Amy Naples from the Plymouth Area Chamber of Commerce, and she'll be joined by Brian Fitzgibbons. So we have a full lineup tomorrow. And again, for your questions today, we have PlymouthInfo@pac-tv.org. Our first question goes to Dr. Gary Maestas. Dr. Maestas, how are the students and the staff and the parents handling these changes and the recent announcement about school not resuming till at least May 4th? And also you mentioned that people are emailing you and phoning you. How do they do that?
You know, that's some really good questions there, Steve. I think this has been a significant challenge for our families because, you know, everyone's home and we have kids that are supposed to be on task doing some activities with their teachers. Our teachers are having to recreate how they deliver services, deliver content to our kids. So we have, you know, preschool teachers that are reading books to kids during the day. We have you know, elementary teachers that are just creating lessons and online interactive work with children. You know, we have middle school teachers that are continually looking at content, how they can support them through that. And we have, you know, high school teachers that are really trying to cover the depth and breadth of the syllabus, which is really difficult because, you know, we're nearing the tail end of the school year, and we have basically a quarter of school left. So I think a lot of thoughts are with our students and our teachers of trying to add some level of clarity on what the expectations are on closing grades, promotion from one grade to the next, and what's expected. And then we have our seniors that are very excited about graduation, but they're also concerned that we get back in session so that they can actually have a real live graduation. So, you know, it's a big change for everybody. I just want to reach out to all our families and students and teachers for really trying to manage all of this because it's very different. As I mentioned before, the commissioner is sending out recommendations for school districts to enter this next phase. this next phase of the closure, and there will be some guidance in there on how to interact differently with kids, more content through virtual means. The problem that we have in Plymouth, and we do have in other communities around the Commonwealth, is accessibility. So we have some families that are just not accessing the content, not accessing the information that we're sending out. We rely heavily on email, we rely heavily on the internet. So, we're really concerned about our families not having that connectivity. We do have some resources on our district website for families that can get free internet if they are unable to connect because of socioeconomic reasons. So there are some resources on our website that they can grab, and they can also email me. And as you mentioned, Steve, our staff is working. They can email me at gmaestas, GMAESTAS @plymouth.k12.ma.us. And typically the email naming convention in school systems like Plymouth is the first letter of your first name and the last name of the individual at plymouth.k12.ma.us. The only difficulty with that is if we have 2 or 3 people with the same first initial and last name, but you'll be pretty successful if you just take that premise. It's been a good transition. I think our families have been very patient. I've had parents emailing me, asking me about, what's my child's grade? When's the report card going to come out? And, one of the things is this thing just started. It wasn't in a convenient time. It was at the close to the end of the marking period. So we'll have report cards will be sent out to elementary families, will be emailed. We're in the process of getting that stuff worked out, but we feel that we're moving forward, and it's a new, we're defining what that new normal is for us. But I'm feeling very good of where we are today, and we will morph as the days go forward.
Thank you. That is Dr. Gary Maestas. He is the superintendent for Plymouth Public Schools. We'll be hearing from him again one more time as we close out today's presentation. But right now, our next question goes to Karen Keene. She is the Director of Public Health here in Plymouth. And Karen, in your initial presentation, you talked about the cases and you explained which ones were positive, which ones had self-isolation and quarantine. Next question to you, how many of these people are hospitalized? And a different question, when will public testing be available in Plymouth, and what will be the process for being approved for testing? Karen.
Okay. Thanks, Steve. So currently of the number 6 that are still in isolation, 2 are inpatient in the hospital. Not necessarily in the hospital in Plymouth, but they are inpatient in the hospital. And I'm sorry, what was the other question?
What will the public testing be available in Plymouth, and what is the process for being approved?
Okay, so we are currently working with Beth Israel Deaconess Plymouth, our public safety, both fire and police, and Walmart to establish a drive-up testing facility. It's in the working stages. It's not been finalized as of yet. But when that occurs, what will happen is you would still need a doctor's order. Anyone who wants to be tested still needs to have a doctor's order to be tested. That is definitive. Once you have your doctor's order, if you want to utilize the drive-up facility that will be stationed at Walmart, you could have that doctor's order. You call the number that we don't have yet, but we will. And you make an appointment to go to that drive-up center. You'll bring your doctor's order at your time of appointment. You'll hand them the doctor's order, and then they'll do some preliminary questions, and then your testing can be done right there on site at the Walmart facility through Beth Israel Deaconess. Currently, if you feel you are having symptoms for COVID-19, you need to reach out to your primary care physician. If you do not have a primary care physician, then you can reach out to your local hospital. Then you'll be given direction based upon answers to some questions that they'll ask you, some qualifying questions as to whether or not you'll go to the next step, which is to be tested for COVID-19. Some people can be exhibiting symptoms which they think are COVID-19, but upon clarifying questions, find out that maybe they're suffering from the flu, or they have a cold, or they have seasonal allergies. So there are specific questions that will be answered before they can go on to the next step, which is the actual test.
Thank you. That's Karen Keene, Plymouth Director of Public Health. Your questions can be sent to PlymouthInfo@pac-tv.org. We're getting a number of questions today. We're next going to go to Robert Eisenstein, who again is the Plymouth Senior Living Consultant. Welcome again, Bob. And Bob, a question for you. You mentioned that the dining rooms are closed in assisted living facilities. Does that mean that the residents are eating in their rooms? And also, how do they deal with the isolation if, in fact, they're confined to their rooms? You did mention about music in the hall, but how do residents deal with that, Bob?
Yeah, generally speaking, they are, for the time being, isolated into their bedrooms, so they get individual tray service, all pretty much on paper products. Most of the facilities are used to doing this from other infections that we've had in the past, so it is fairly routine inside of the facilities. They will be able to do some small group meetings depending on the condition of each individual resident, but everything is individualized right now. So as a precaution, most of the facilities are doing individual room isolation with the staff going in and out of the individual rooms on paper tray servings to reduce any problem with infection control. So that's what's happening right now.
Thank you, Bob Eisenstein, and he is our Senior Living Consultant. And now we're going to go back to Matthew Muratori. He is our Plymouth State Representative. Matt, we have a number of questions, some of which may relate to the federal package, so we may have to get back to people. But the first one has to do with the state, and the question is, what is the state doing for our homeless population?
Yeah, and I alluded to that in my comments. That's something they're actually working on now. I know the city of Boston actually has put tents up for some of those. Chairman Tavares and I spoke briefly this morning about this for Plymouth, what we're doing. And I think this, I know the Board of Health spoke about it yesterday here in Plymouth. So there's some more discussion about that and some more guidance that will be coming out shortly.
Thank
from
you.
the town.
Matt, could I add?
Go ahead, Ken. Kenneth Tavares, Chair of the Plymouth Board of Selectmen, adding further. Ken, welcome.
Yeah, as Matt said, we spoke earlier today, and a number of questions have been asked. And while we've been doing the program, a very lengthy memo came in. So we asked a number of questions that pertain to the homeless. And I would assume that probably for a good part of the afternoon, we'll be going through these answers and formulating a plan.
And you'll be hearing back from Ken and the town manager, Melissa Riggi, in tomorrow's update. Matt, another question. First of all, we recognize that the federal stimulus package has passed the Senate, but is still waiting for approval from the House of Representatives. But being mindful of that, if you know, is there anything in the package for Social Security recipients or retirees?
I believe there is something in there for retirees. The specifics of that I do not have yet, but I'm sure as a packet becomes clear, we will have that. But as for Social Security, there's no changes in Social Security. People get the Social Security checks.
Thank you. And for our viewers, we did have Stephen Cole, Executive Director of the Plymouth Regional Economic Development Foundation, scheduled for today's program. But because of the stimulus package, he's asked to come back another day because he's trying to serve the businesses that have been affected by this. And this may be a question for him, but Matt, perhaps you can help. The question is, how do small businesses apply for the federal loans, and what is a forgivable loan, if you know?
Again, the forgivable loan that I talked about, that will be part of the stimulus package once that's passed by the House and signed by the president and deciphered to see what's in there, and we'll get more clarity on that over the next several days. As for businesses, there is a disaster loan that small businesses can apply for in the Commonwealth. If you go to mass.gov /COVID-19, and search there. You'll find the disaster loan application. It's a simple application for the Commonwealth that you as a small business can fill out. There's also the federal government has a small business administration that will be that people can apply for. A lot of people have applied for them already, and we encourage people that are small businesses to apply for the SBA small business loan.
Thank you. That's Matthew Muratori. He is the Plymouth State Representative. And before we go back to all of our guests for a wrap-up for today's presentation, again, I'd like to remind viewers we'll be back here every day except Sunday, Monday through Saturday at 12 noon. We're taking your questions at PlymouthInfo@pac-tv.org. All of our participants have been answering your questions each day, and if we don't have the answer, we'll be sure to get back to you. You can also go to pac-tv.org for replay information because we are replaying the daily live broadcasts. Again, tomorrow, Selectman Chair Ken Tavares will be joined by Town Manager Melissa Arrighi. We will once again have Representative Matthew Muratori to provide information as to the latest state update. Roxanne Whitbeck is our veterans agent, and she'll be speaking specifically about how this has impacted veterans. We have Amy Naples, the executive director for the Plymouth Area Chamber of Commerce. She'll be talking about a special program with her guest, Brian Fitzgibbons. It's a special program for businesses. Finally, on the medical component, we have Nancy Gantz representing the Board of Health. We have Danielle Fusco, who is a regional clinical specialist right here in Plymouth for Plymouth Rehab and Healthcare. And again, Dr. Philip Trifletti. He is a primary care attending physician with Beth Israel Deaconess. Those are our guests for tomorrow as you prepare your questions for PlymouthInfo@pac-tv.org. We're now going to go back to our participants and ask for a final message. What would you like people to remember as they've watched today's broadcast? Dr. Gary Maestas, Superintendent of Plymouth Public Schools. Gary.
Yes, I would like our students and families and, everyone that supports them to know that we are strong. We have the resolve to get past this, and all of us together can do remarkable things. And I'm just encouraged by the amount of support that we're seeing throughout this community. We're providing lunches to families. We're doing everything we need to do to step in. And it just humbles me to know that there are so many people out there that really want to give of themselves. Unfortunately, this is a time that we have to be a little bit more concerned about our own health than anyone else's. So it's just one of those things that it's a tough balance to strike, but there are ways to still support each other and help. I know the internet is a key fixture, and people were telling me the other day, I based on what we've experienced here, I think the internet should be like a common utility, that everybody should have it. And that's one of the things that we're starting to realize is there are some voids out there, and hopefully we can close those voids. I want anyone out there to send me an email if you know a family that's not getting food, or a kid that's just not getting resources, internet activity or any of that stuff. We can assist with that. We've distributed over 400 Chromebooks in the last few days for families that need. But again, we're just trying to make sense of everything, and we want our kids to be engaged. One other point I'd like to make, Steve, is the social and emotional health of our families and students is really important. There are resources available during this difficult time. Those of us that are in isolation every day may need some level of support. So we do have some resources on our website. There's a COVID-19 section that has a variety of resources that our families can tap into, and the community as well. So just want to thank this community for being so supportive and being just, Plymouth just comes to the aid of people. It's amazing. We have almost 70 volunteers that are going around helping to deliver food. We have lunches being delivered. We did 400 lunches today. So it's just awesome to have this kind of support in this community. So thank you for listening.
And Dr. Maestas, again, for people who may not have seen you on prior cablecast, tell us again where students can receive free lunches.
Yeah, every day you can get a lunch over at Hedge Elementary School. You get lunch or breakfast. You can get lunch at Indian Brook Elementary and breakfast. And we're also going to be, I think it started today, the Algonquin community here in Plymouth, they had closed their community center, and that's where we were dropping off bags of breakfast and lunch. We're actually distributing breakfast and lunch for the Algonquin community in the Walgreens parking lot. So we have a truck that goes over and we distribute lunches out there. That started today because we couldn't get into the community center there at the Algonquin Heights community. So we're also delivering tomorrow morning. We will be available from 11 to 1 at 5 different locations in Plymouth for backpack food. So these are non-perishable items. And they are at Hedge Elementary. We'll drop them off at Algonquin Heights, PCIS, West Elementary, South Elementary, and Indian Brook. So we have these sites around the community that you can receive food. And go to our website. Again, we have notices of exactly where those locations are to really help with our partners, the South Shore Community Action Council, the EAPC, Education Association of Plymouth and Carver, the COBRA union here in Plymouth, and it's all coming together through the Plymouth Education Foundation, where they reached out and made a donation, and others contributed to that, and we're able to feed people that we never thought we'd have to under these conditions.
Thank you. That's Dr. Gary Maestas, Superintendent of Plymouth Public Schools. You're getting great information, and one of the things we're striving to do is give you verified information from trusted sources, from authorities locally in Plymouth, so that all of us in Plymouth have accurate, up-to-the-date information each day. And now we're going to go to Karen Keene. She is the Director of Public Health in Plymouth. Karen, what do you want people to remember today?
I want people to know that my staff is still working, that we're still here taking care of our residents and our visitors, that we're checking our emails and our voicemails constantly. I hope everyone received the reverse 911 phone call that was sent out with some additional information, some websites, some tips for people could follow. One of the ways that we're still involved is prior to even Governor Baker stopping self-serve at all restaurants, the town of Plymouth decided that that was an appropriate thing to do. And my staff is out making sure that restaurants and gas stations who offer self-serve and hotel lobbies that might have offered self-serve are no longer offering anything that's self-serve, whether it be coffee, tea, or anything like that, that everything is being done by staff and then handed over to the customer. Also, when the governor issued his order for essential businesses, we were inundated with phone calls, both sides. People who felt that their business should be essential and people who felt that their business, though the business they worked for was not essential and they should not have to go to work. So I would like people to know that there is a website and an email address for the state that they can reach out to discuss those exact things. And it's COVID19.biz, B-I-Z, @mass.gov. And that way they can express their concern whether they believe that they should have an exemption and be able to remain open, or whether they feel that the company that they work for should not be allowed to stay open, and they're concerned about the fact that they are still open. That's a resource that folks can utilize. And then finally, something that doesn't have to do directly with COVID-19, but is still important for those of us at the Public Health Department. We also deal with septic systems in private wells. In these days where most of us are at home, probably longer than we usually are, and we have our family members at home with us, and we're utilizing our septic systems probably more than they've ever been utilized before, I want to remind people to please not flush anything down their toilets besides toilet paper. Even if it says disposable wipes, please do not flush those down the toilet. Whether or not you have a septic system or you're on town sewer, it doesn't matter. those items can actually cause what's called a fogberg, which is the fats, oils, and grease. They can all mold together with the wipes because they do not break down and could actually cause blockage either for your personal septic system or for the town sewer system. So just a reminder, as we're all staying at home, can we please just flush toilet paper down the toilet? Thank you. And thank you,
Karen.
Steve, for doing this.
That's
I think it's
of course
fantastic.
provided people have toilet paper. However, at this time, we're going to once again welcome Robert Eisenstein. He is our Plymouth senior living consultant. And Bob, if people are watching and they have more questions for you, how can they contact you after today's presentation?
I was going to offer that. Thank you, Steve. I'm at Robert at EIS, as in Sam, FLA.com. So it's Robert at icefla.com. And I would say there's three major things that I'd like people to take away. Number one, our elders are very safe right now. We have, as everybody knows, we have quite a few senior living communities in the town of Plymouth between assisted living and nursing home. And I mentioned earlier, we really have to support all of the staff that are working on our behalf, taking care of these elders. We're on the phone daily, getting updates from the federal government, from the state government. Matt mentioned Mary Lou Sutters. There's government proclamations that are coming out every day. So we're getting the most updated information out quickly, sometimes more like twice and three times a day, to make sure that our staff have the resources they need. The second thing I would say is, again, just an understanding from the public that the visitation restriction is very, very important. And unfortunately, every once in a while, we do have some folks that are having issues with that. But I hope everybody would respect the reasoning for this. This is the best way that we can protect those that are inside of the facilities. And the third thing is, it's a time to get very creative with remote communication. I know there's a lot of kids out there at home. If anybody has any ideas that they want to partner with the nursing homes, with the assisted living, you can always contact me. Our elders are actually much more savvy with internet than I think we give them credit for. And they absolutely love the contact. One of the callers earlier mentioned the concern about social isolation, and that's absolutely a concern of ours. So the more interaction we can have remotely with all of our seniors, just like we're doing today, Steve, is the third thing that I would offer. And if anybody has any ideas to be creative in that regard, please give me a call. I'd love to work on projects with the kids that are home from school. Gary, that's a shout out to you as well. A lot of opportunity to stay in remote contact with our elders. So thank you for the opportunity, and anybody that would like to contact me, it's Robert at icefla.com.
Thank you. That's Robert Eisenstein. He is a Plymouth senior living consultant. And Bob, yesterday, in fact, I announced that one of our seniors in her 80s, who is a resident at one of our Plymouth senior housing facilities, told me how soothing it is for her to watch us each day. She likes seeing the familiar faces. She likes getting updates of what's happening in Plymouth. And so we hope to be able to continue to do that for the foreseeable future as a part of this presentation. We're now going to return back to Plymouth State Representative Matthew Muratori for your final words, Matt.
Thank you, Steve. And I want to follow up on something Bob had brought up as well. There are over 36,000 Mass Health members receiving personal care assistance in the Commonwealth, and many in the town of Plymouth as well. There's actually a hotline number that if for some reason your personal care assistant attendant is not coming to your home for whatever reason, there's a hotline number that I want to give everyone, which is 1-844-422-6277. That's 844-422-6277, and they will help you out. And also, as part of the order for the governor yesterday, he's assembled a group of medical experts to support the command center. So there's now an advisory board of expert medical folks from the Commonwealth that are part of this. So you can rest assured that in the Commonwealth we are getting the best experts with regard to this virus and the advice that they're going to provide to us as we go forward over the next few weeks. Again, I'm going to end, as I do every day, the Red Cross is in desperate need of blood and platelets. And please, if you can go to the Red Cross site to actually sign up. There is a Red Cross Center in Rainham. If you're looking for things to do and you're healthy, go to the redcrossblood.org, where you can call 1-800-RED-CROSS, and they will get you hooked up, literally hooked up, and get you to give blood. But please, we've never seen a shortage like this ever in our nation. So please help out. And also, and I think Steve will probably talk about this in a future show, but unfortunately, when a lot of good things are happening, and as Dr. Maestas said, we should be so proud in this community of what's happening. I now know that there are other leaders around the Commonwealth that are doing what we're doing now, but we started off right off the bat doing this. We realized the need to communicate to people, even though all of us are very anxious and concerned, but we are leaders in the community, and we have stepped up to communicate to folks, to give them reassurances, to give them facts, as you say, Steve, so they know exactly what's happening here in the town of Plymouth and around the Commonwealth. And other communities are following our lead. So I'm so proud as well to be representing this community and working with all of you and so many others that are volunteering and working from home remotely in this community. But we do need to watch out for the scams. There are a number of scams, new scams that are coming up, and we may want to elicit the support of maybe the Sheriff's Department or somebody to come on to kind of help us with that, to see what are the scams out there, to kind of stay away from those. And finally, we as state reps are still working diligently on a daily basis. Today, I have a municipality conference committee at 2 o'clock, where we're going to be talking about the proposed legislation that the government proposed 2 days ago with regard to municipal government. So we'll be doing that today. Tomorrow, believe it or not, tomorrow afternoon, we have a tourism committee update, because it's really getting pretty desperate out there. I just reading that just came over to me that the hotel workers, there's over 150,000 hotel workers that have been laid off in the Commonwealth, and another 75,000 plus that are related to tourism that have been laid off. And of course, a lot of these workers are not the highest income folks at all. So we really need to do some more with the tourism group as well. And of course, at some point, we haven't mentioned, but we will at some point, the Plymouth 400. Obviously, that is on hold now. I know there's some discussions going on in the background, and at an appropriate time later on down the road, there'll be more information about that. But we can't forget our folks in the tourism industry, and particularly in our own town, where tourism is number one, and we do have folks that are struggling out there. And finally, just as a reminder to folks to reach out, call 211 with any questions at all. You can also go to the mass.gov/COVID-19 website that gives you the up-to-date information. And as I talked about the other day, we have the text now through the state. You can actually go to when you go on your text and it says 2. You want to type in COVID, ID, COVID-19, COVID, 19. And then you want to put in the number 88877. And hold on 1 second. I just want to double check that. Yeah. 888. So when you go to the 2 line, I'm getting confused myself. Put in that 88877, and then in the message line, put COVID, COVIDMA, and when you'll get text alerts as soon as they're available. And finally, the governor is on at 2 p.m. to give the daily update. So feel free to tune in to get your most up-to-date information from the governor. And thank you again to pac-tv and you, Steve, for reporting.
Thank you. That was Representative Matthew Muratori from the town of Plymouth, zooming in once again, as he does each day, with Kenneth Tavares, chair of the Plymouth Board of Selectmen, who will be giving us his final thoughts. Ken.
Thank you, Steve. My thoughts will be brief. I just want the citizens of this community to know that you are not alone. There is so much going on as has been detailed out to you today. If you have questions, contact us through the Town of Plymouth website. We will get you the answer. And if we don't have it immediately, we can find it. Everyone is working at maximum pace. And I'm extremely proud of the employees of the Town of Plymouth that you may not see them, but I can tell you they care about you and they are working very, very hard behind the scenes. This is a marathon. It's going to take a steady pace, but we're going to get there and we will beat this virus. Thank you.
Thank you. And that's Ken Tavares, Chair of the Plymouth Board of Selectmen, joining us today with all of our participants, Representative Matthew Muratori, Dr. Gary Maestas, who is the Superintendent of Plymouth Public Schools, Karen Keene, the Plymouth Director of Public Health, and Robert Eisenstein, who is a Plymouth Senior Living consultant. Again, your questions can come to PlymouthInfo@pac-tv.org. You can also get information on replays from pac-tv.org. And again, tomorrow's lineup, joining Kenneth Tavares and Matt Muratori will be Roxanne Whitbeck. She is the Plymouth Veterans Agent, and she will be joined also by Melissa Arrighi, who is our Plymouth Town Manager. We have a health component with Nancy Gantz from the Board of Health. We also have a regional clinical specialist for Plymouth Rehab and Healthcare, and that is Danielle Fusco, and also Dr. Philip Trifletti. He is an attending primary care physician with Beth Israel Deaconess. And on our economic business update, Amy Naples once again joining us from the Plymouth Area Chamber of Commerce, and she will have Brian Fitzgibbons, which will tell us about a new project called Order Local. It's an Order Local project. We'd like to thank all of you for joining us today and each and every day at 12 noon. Good day. I'm Steve Trifletti, Plymouth Town Moderator. Thank you.